Want to network who's out there.
So want to network who's out there?
Briefly.
Briefly.
Someone wants. What?
Well, how about this? Who's here from Oregon? Anybody want to? I'm here from Oregon. Yeah, yeah. I'm seeing some hands up. Totally.
Marianne from MHAAO.
Oh, great. Okay, so now my next question is, who is here not from Oregon? Ooh, Ben Cooley Hall, I see you. I see other people too. Thank you for coming.
Anybody from outside the U.S.?
Anybody from outside the U.S.?
Where?
I see a hand.
Where? You're muted.
Hi, I'm from Iceland, Reykjavik, Iceland.
Nice.
Nice.
Maybe will help be worthy of your sagas.
Maybe we'll do
Yes, I have no doubt, yeah.
What other states are out there?
Someone messaged in and said they were from Alaska.
Nice.
And then someone just said Rhode Island. And Ben Hall, where are you from? Yep.
I'm the one who said Rhode Island. I'm here.
Oh, Rhode Island. Okay. And then we got someone from Utah as well. Arizona.
How many like us identify as psychiatric survivors?
How many like us
identify? Fists.
How many like us identify as psychiatric survivors? Let's see some fists.
Yay.
Yay.
I'm a survivor of forced drug injections. Anybody else been the sharp end of the needle?
I'm a survivor of forced drug injections. Anybody else been on the sharp end of a needle?
Kevin. Hi, Kevin.
Kevin. Hi, Kevin.
What does it say?
Insane Liberation Front.
Nice.
Nice.
And then Kevin, do you want to tell us, you said something in chat about the state you're from. You want to tell it what that said?
Yeah, I'm from the state of nonconformity.
I think that's actually a nation.
Or a species.
So, Kevin, I talked briefly about Insane Liberation Front.
So Kevin, I talked briefly about Insane Liberation Front
during my keynote.
Tomorrow.
Is Tom Wittick still around?
Is Tom Wittick still around? No.
He died?
He's still around. He's just, I haven't connected with him in about the last 18 months. He was running a Hearing Voices group in Portland about 2 or 3 years ago, but I haven't seen him for about 18 months. He's still around.
If you track him down, please put him in touch.
Well, if you track him down, please put him in touch.
How about current mental health consumers? I see a shrink. Who else lost?
How about current mental health consumers? I see a shrink. Who else does?
And he does not mind being called a shrink.
And he does not mind being called a shrink.
caregivers say is if you're not crazy, you may be nuts.
What my caregivers say is, if you're not crazy, you may be nuts.
Sure, would you like to introduce yourself? You're in Florida, working on becoming a counselor.
Sheila, would you like?
Yeah, I'm Shira. I work for the National Empowerment Center, and I'm helping the National Coalition with co-sponsoring this conference. And as David said, I'm also a grad student in counseling and have been involved with the peer movement for a while. And I'm super excited about this workshop. If you have any technical issues, or need help with anything on Zoom, unmuting yourself or things like that to ask questions, feel free to just send me a message over chat, or I'll type in my email. You can email me if you get knocked off or something like that.
Sure is helping coordinate everything here.
Shira is helping coordinate everything here.
Questions, comments, chat, breakout.
Questions, comments, chat, breakout.
Thank you, Shira.
Thank you, Shira.
Well, we have about 1 minute or two left. Anyone else want to network?
Well, we have about 1 or 2 minutes left. Anyone else want to network?
Yes, David, I got somebody that wanted to say hello to you, and hopefully you remember her. Her name is Karen Whaler, and she knows you, she says, and she's now the CEO of Gobi, and she's very active and doing a lot of work and putting forth efforts and wanted to be here, but she's been under a lot of pressure, and she's taken a couple of weeks off, and I'm going to report back. I don't know how it goes. She was doing Indian affairs, and she worked in Salem for a while, and she's about my age, late 50s, and
Please ask her to email me.
Please ask her to email me.
And also, we encourage any of you to please email me about affiliation or sponsorship or anything.
And we encourage all of you to please email me about affiliation, sponsorship, or anything.
Or Christina, Friedman.
Or Christina, for that matter.
Yeah. Hey, David, do you want to put your email address in chat? I know that it's in the slides too, but I'm going to put my email address.
Yeah, Ian will. By the way, this is the wonderful Ian.
By the way, this is the wonderful Ian.
Super duper fantastic.
Super duper fantastic.
Ironically humble.
Ironically humble.
Revolution at ACIU.
Yes,
.info.
pronounced like a sneeze.
It's pronounced achu, like a sneeze.
It disappeared. I just looked up. Revolution, what is it? At AICU?
ACIU.info. INFO.
Hey, this is Terry from Alaska. I just want to say
Hey,
hi,
Terry.
David. It's good to see
Hi.
you.
Hi, Terry.
And all the work you're doing, it's amazing. I'm working in this process here, decolonizing and housing people and all this intersectionality that's up here. It's very much different than Portland. I miss Portland a lot. But there's a whole thing, they use the word two-spirit up here to talk about individuals' disabilities in the indigenous community. They don't use it for queer, but it's kind of gaining ground around that. But it's interesting up here.
So like two-spirit instead of like dual diagnosis?
Yes.
Yeah.
Yes. But all the rest of the country use it for queer indigenous because there's a special role for queer folks, but there's also special roles for people with disabilities. And I think you guys have watched that crazy, oh gosh, I can't even remember the title of that film that came out.
Crazy Wise?
Yeah, just Crazy Wise. Yes, yes, yes. So that's just real up here.
Can you admit tomorrow?
Oh yeah, sure. There we go.
Well, this might be a good time to start.
This might be a good time to start.
Sure. Did you have any housekeeping?
Shira, did you have any housekeeping?
No, we just ask that you, I'm trying to mute everyone, so just keep yourself muted if you're not speaking. And yeah, feel free to ask questions in the chat. And yeah, if you have any issues with the muting or with the chat or anything, feel free to reach out to me.
Yeah, after Chrissy's workshop, we have a little Q&A.
After Chrissy's part of the workshop, we have a lot of little Q&A.
And then I do my workshop.
And then I do mine.
Well, more Q&A.
We'll have more Q&A.
And then we going to do breakout rooms.
And then we go into 2 breakout rooms.
So Chrissy in one, and I'm in the other.
Chrissy in one, and I'm in the other.
And we have a break in the middle of this.
And we have a break in the middle of this.
Okay.
Okay.
Ready?
Ready?
Well, welcome everybody.
Well, welcome everybody.
Winning human rights and mental health.
Winning human rights and mental health.
Campaign action team support.
Campaign action team support.
Which, by the way, spells cats.
Which, by the way, spells cats.
And here's one simple takeaway from today.
And here's one simple takeaway from today.
How we have to admit somebody here.
Oh, we have to admit, oh, the waiting room is popping up on us. Okay.
Submit.
Hold on one second. I think Shira's taking care of this right now.
Okay.
So if there's one simple takeaway.
Combining peer support and activism.
Combining peer support and activism.
And I know we're all about peer support here.
I know we're all about peer support here.
But how do we apply this in a unified, supportive way to activism?
But how do we apply this in a unified and supportive way to activism?
And I have the honor to introduce someone who personifies that.
And I have the honor to introduce someone who personifies that.
Chrissy had a very rough childhood.
Chrissy had a very rough childhood.
Overdrugged. She went on to get all the training she could.
She went on to get all the training that she could.
She co-chairs Oregon's Consumer Advisory Council.
She co-chairs Oregon's Consumer Advisory Council.
She's done that for a decade.
She's been on that for a decade.
Done co-chairing for a decade.
She's been co-chairing for a decade.
And but for me.
Sorry,
how long were you co-chair?
I'm sorry, Chrissy, for how long were you a co-chair?
This is actually my first term of co-chairing. I don't think it'll be the last because I think I really need a couple terms to really, if I want to step up to the next level. But I have been on the Consumer Advisory Council for the state of Oregon for a decade. And I even started in the youth position and aged out of that, but still wanted to help.
I roll corrected.
I roll corrected.
Finally, the main thing for me is what a joy working with Chrissy all these years here in Eugene.
The main thing for me is what a joy working with Chrissy for all these years here in Eugene.
Chrissy combines this passion, enthusiasm, joy.
Chrissy combines this passion, enthusiasm, and joy
with activism for serious cause for youth rights and human rights and mental health.
With activism for the serious cause of youth rights and human rights in mental health.
So take away, Chrissy.
So take it away, Chrissy.
Ooh, thank you so much, David. That was a really beautiful intro. And thank you so much for this opportunity to do the workshop for Mind Freedom. So I have been working with Mind Freedom since I was 22, and now I'm 33. So that's about 11 years. I just really enjoy working with Mind Freedom because it's a grassroots organization that works with mental health rights and activism. I really feel like Mind Freedom is also unique in many ways. I still feel like they hold strong elements of being radical, and Mind Freedom isn't afraid of having skits or props. I will never forget the time that I got to participate in a bed push through downtown Eugene, Oregon. I also really enjoy that they utilize arts and crafts, and they're not afraid of yelling, being angry, and being seen. That's my jam. And I gotta be real, David is right. I am definitely a peer of the mental health system, not just an ally. In fact, I remember my first panic attack when I was about 6. I just felt these emotions bellowing out of me, and I just couldn't grasp them as they were fleeing. And I felt so overwhelmed that I backed myself into a corner, slid down, and grabbed my knees and just shook my head. I know that that was not the only panic attack I had as a child. I was put on medication when I was in middle school. This is where I really feel like I picked up the title Consumer Survivor of the Mental Health System. I was over-medicated. My prescriber became a trigger for me. So she saw the worst in me and medicated me to oblivion. When I finally got off of medication, I want to say very clearly that the craziest I've ever felt in my life was when I was on all that medication. And then at 19, when I got off medication, I could see that I wasn't where my peers were. I had a lot of catching up to do. I really froze during the time that I was on medication. I didn't really get to grow. I didn't move out of my mom's house until I was 23, and I really needed my friends to just pull me out and really save me from that environment. But what else saved me was my volunteer work. Just like David said, I was really adamant in taking every workshop, training, webinar, conference I could. And this really helped me, especially when I echoed what I was learning in my community in my own therapy. It also really helped me being a peer support specialist. I was one of Oregon's first youth peer support specialists. And that wasn't even my first peer title. In middle school, I held a peer title called PCM, a peer conflict mediator. And it was a way for students to access peer help for conflict resolution rather than going to a teacher. I just really enjoy being a peer. And I really enjoy helping to have wins for consumers in the mental health system. Next slide. So wins in the mental health system and peer movement, campaign action team support. So I just want to say these are some of the wins that I really feel like that I have seen over the last couple decades in the consumer movement, which is consumer voice at every level. I have participated in city, county, and state level advisory councils. And I even work with a lot of organizations that have a national voice. Peer-delivered services are widely offered. And I just want to encourage you all to ask your healthcare team if peer-delivered services is available for you. I have seen the impact, and I've even lived the impact of peer-delivered services, both on the consumer as well as the peer support specialist. And honestly, you guys know this, it's beneficial to both. So the more talking, less stigma. I really feel like that we're seeing more well-rounded holistic depictions of people with mental challenges in mainstream society. Now, I know that we probably can think of like our top 3 worst examples of people with mental challenges in the media or in TV shows. But in reality, I feel like I'm beginning to see ones that really seem more respectful and more realistic. I personally like Lady Dynamite off of Netflix. The show really starts with her coming out of like an inpatient treatment program and trying to like start her career again, which is comedy. And I just really appreciate seeing those echoes of day treatment programs that seem really authentic. I also feel that coping skills are much more mainstream now. I really feel that I cannot go on any form of social media and look at and like scroll through my feed without seeing one of my friends either utilizing a coping skill, talking about needing more coping skills, or reaching out for help. I feel like this is a way that consumers are really coming out of the closet, especially now when like the word of the year is uncertainty, brought to you by COVID. So even more now, I really feel like coping skills and having mental health challenges is very much more mainstream. All this reduces stigma and really helps us with that barrier of stigma. A really great example of this is mental health care days are in law. A new Oregon law allows students to take mental health days off from school, just as they would sick days. Under the new state law, students can have up to 5 excused absences in a 3-month period, which now can be used either for sick time or mental health days. Next slide. So campaign, SMART goals, specific, measurable, attainable, realistic, and time-oriented. It is important to hit each letter when you're creating a goal. Having new content. It's really important to try and stay fresh and have new content, whether that's through different forms of media like podcasts, Facebook posts, blogs, and events both online and in person when COVID allows. And you want to keep having fresh encounters with your support and volunteers, whether that's through emails or even different ways like mailing parties, bake sales, chili cook-off. Fun Run is a really popular one I'm seeing for a lot of organizations. It seems like a healthy way to get together. I find it's really good to try and reach more than just one attribute of your volunteers. I mean, it's fun to do more than just activism together. It's intentional community. And how can you build excitement or maintain interest? You really want to allow your volunteers to shine in many ways. You want to keep things positive and supportive. Have fun goals that are built relatability to your message and remind them of the relevance for their lives. Next slide. Action. So keeping people motivated. Through all my years of activism, I have found 2 surefire ways to help keep volunteers motivated, and that is feed them or pay them. Honor our time. And then staying healthy as a volunteer by having radical boundaries. Radical boundaries are foundational, and they keep things healthy and professional during our volunteer activism. It's also really good to remind your volunteers of what they're getting out of this. This is a way to really set the level of energy and drive for whatever action that you want to take on for your organization. Important things you can tell people is it's personal growth. This is social support. This is part of our recovery. I definitely feel my activism is part of my recovery. It's about helping others to not go through what we went through. And it is extremely self-rewarding. Also, when thinking about actions for your organization or your nonprofit, it's really good to have it easy to replicate and easy to follow. This can be even more important and vital if you want to send that type of action or project and replicate that for affiliates or other organizations, or even later for your own group to do again. Next slide. Team. So you want to make a lot of small goals and make all your goals have backup plans A through Z. It can be helpful in the pursuit of wanting to be successful with what you're doing to have backup strategies for getting your goals accomplished. This is really just another form of having a trauma-informed approach not just for your volunteers, but also for staff. Another really key point with the idea of team is having a simple and thorough new volunteer process. This is the first encounter with taking a new volunteer into your organization, and let's sculpt that with intent. It's also really important to know that if you thrive off a high number of volunteers in key positions, do not make your organization contingent on overutilized and unpaid staff. It's like building a house on sand. Build team skills constantly. All good nonprofits have a revolving door of new and key volunteers. It is just as important for the leadership to know the skills of a newbie as it is for that newbie to have a way to learn how to work with other established volunteers. Let's go to the next slide. Support. Obviously, remember, we all need support, staff and volunteers alike. I like to have support built into the positions of staff and volunteer positions, and I really like to see that role modeled by management and leadership. Also have well-established structure for offering stability throughout the organization. This is another one of those trauma-informed approaches for the volunteer and staff. And it should start with like the first interaction, whether that's staff hiring paperwork in the interview process or whether that's the volunteer orientation process. And then lastly, and I found this one really beneficial, offer opportunities for volunteers to talk together. There must be a place where they get a chance to mutually support each other internally. Okay, so let's go into the next slide. Okay, so this is, thank you all. That was sort of my presentation. That was a little bit faster than I expected. I'm sorry about that, but I want to talk about the amazing David Oakes. So David Oakes came from a working class family and had to stitch together enough scholarships to attend and graduate from Harvard. He rejects the biomedical model that defines contemporary psychiatry. The same year I was born in 1986, the project that would eventually become Mind Freedom International began as a newsletter. In December, was someone talking? In December of 2012, David Oakes fell off a ladder and broke his neck and is now paralyzed. But that hasn't stopped his passion and determination to being an allied voice for those being abused and oppressed by the mental health system. He started a consulting business called Achu, where he still gets to bring us his unique viewpoints and keeps us in the know of all the latest injustices of the mental health system. So I just want to thank you so much, David, for not only all of the stuff that you have taught me and all the guidance through the decade I've been able to spend with not just Mind Freedom, but you, but also everything that you're doing for consumers alike across not just this nation, but this world.
Well, thank you, Chrissy.
Thank you, Chrissy.
And in a little while, we will have time for a break and Q&A, but I'll go ahead with my presentation.
In a little while, we're going to have time for break and a Q&A, but I'll go ahead with my presentation.
And this is a good slide.
And this is a good slide.
To transition Chrissy to my workshop.
To transition from Chrissy to my workshop.
Because what this is in a parade here in Eugene.
Because what this picture is, it's from a parade here in Eugene.
Like the brown beret is my wonderful and tremendous wife, Deborah.
And in the brown beret is my wonderful and tremendous wife, Deborah.
Who you ought hear laughing in the background.
Who you could hear laughing in the background.
Say hi, Deborah.
Say hi.
So this parade entry was raining and cold that day,
So this parade entry was raining and cold that day,
and we almost canceled it.
and we almost canceled it.
But Chrissy had such enthusiasm and passion,
But Chrissy had such enthusiasm and passion,
and Howard on the right, who identifies as autistic, showed up.
and Howard on our right, who identifies as autistic, showed up.
So off we went.
So off we went.
And like I joked in the beginning, if you're not crazy, you may be nuts.
And like I joked in the beginning, if you're not crazy, you may be nuts.
Yes, having an identity as a psychiatric survivor is important to me.
Yes, having an identity as a psychiatric survivor is important to me.
I experienced 5 lockups
I experienced 5 lockups
in the 1970s.
in the 1970s.
I had forced drugging,
I had forced drugging,
spent several times in solitary confinement.
spent several times in solitary confinement.
One of those times I remember pounding the screen.
One of those times I remember pounding the screen.
It was one of these impenetrable steel screens.
It was one of these impenetrable steel screens.
And I just kept pounding it with my fist.
And I just kept pounding it with my fist.
And I said, when I get out of here, I'm going to do some major damage to this oppression.
And I said, when I get out of here, I'm going to do some major damage to this oppression.
And like Chrissy said, there have been a lot of victories over the decades.
And like Chrissy said, there have been a lot of victories over the decades.
I've been involved for 44 years.
I've been involved for 44 years.
Tomorrow during my keynote, I'll talk about some of the early leaders.
Tomorrow during my keynote, I'll talk about some of the early leaders.
And as a Harvard student, I was placed as an intern with one of the early activist groups.
And as a Harvard student, I was placed as an intern in one of the early activist groups.
And after I graduated, I studied Saul Alinsky's approach.
And after I graduated, I studied Saul Alinsky's approach.
So I applied community organizing to this work.
So I applied community organizing to this work.
And over and over, we simply use the phrase strength in numbers.
And over, we simply use the phrase strength in numbers.
And now here's an example where it's a small group.
And now here's an example where it's a small group.
But we had a blast.
But we had a blast.
We reached thousands.
We reached thousands.
That banner is from Oregon Country Fair,
That banner is from Oregon Country Fair,
where 50,000 people celebrate.
where 15,000 people celebrate.
50
Oh, excuse me, 50,000 people celebrate
each day.
each day.
So, next slide.
Next slide.
So, one of the groups that has done real well with mind freedom is Mind Freedom Ireland.
One of the groups that's done really well with Mind Freedom is Mind Freedom Ireland.
And just over the word mind in this photo is Mary Maddock.
And just over the word mind in this photo is Mary Maddock.
What happened is that decades ago, after a birth of a child, she had a mental problem.
What happened was that decades ago, before the birth of a child, she had a mental problem.
After
Excuse
the
me.
birth of
After the birth of a child, she had a mental problem.
and the system got her locked up, gave her forced shock,
And the system got her locked up and gave her forced shock.
broke her spirit, and she spent many years on heavy drugs.
So it broke her spirit, and she spent many years on heavy drugs.
But she connected with our movement,
But she connected with our movement,
and she and her husband created Mind Freedom Ireland.
and she and her husband created Mind Freedom Ireland.
And on your right there, John McCarthy,
And on your right there, John McCarthy,
who's now deceased.
who's now deceased.
He has held some of the biggest events in our movement
He has held some of the biggest events in our movement
ever.
ever.
Many gatherings in public parks in Ireland
Many gatherings in public parks in Ireland
with music and food.
with
And-
music and food.
It kind of looked like the Oregon Country Fair,
And it kind of looked like the Oregon Country Fair.
and all to challenge the mental health system,
All to challenge the mental health
to
system,
challenge normality.
to challenge normality.
I visited there to find out what did they do so well,
I visited there to find out why did they do so well.
and I really think Mary and Jim, their love for each other helped keep the group building.
And I really think with Mary and Jim, their love for each other helped keep the group building.
Next slide.
Next slide.
So here we are locally in Eugene
So here we are locally in Eugene.
with, you see, Chrissy.
So you could see Chrissy,
And this was about electroshock.
and this was about electroshock.
So, yes, I know we could talk for hours about abuses in the mental health system,
So yes, I know we could talk for hours about abuses in the mental health system,
forced-drugging, solitary confinement,
forced drugging, solitary confinement,
restraints,
restraints,
homelessness, electroshock,
electroshock,
discrimination,
discrimination,
labeling.
labeling.
But what brings us together?
But what brings us together?
And yes, fighting action, fighting for change, activism, yes,
Yes, action, fighting for change and activism,
but also each other and building community and support.
but also each other, building community and support.
Here in Eugene, we hold a monthly meeting of Mind Freedom Oregon.
Here in Eugene, we hold a monthly meeting of Mind Freedom Oregon.
Now, one thing we did was how do we work with more moderate mental health groups?
So one thing we did was, so how do we work with more moderate mental health groups?
We actually started the OPAL network.
We actually started the Opal Network.
For 10 years, we have met quarterly
For 10 years, we've met quarterly
with some of the more moderate mental health groups.
with some of the more moderate mental health groups.
Because they all say at least they believe in empowerment of mental health consumers.
Because they all, or they say at least, that they believe in the empowerment of mental health consumers.
With COVID, we haven't had much, but why our Mind Freedom Oregon is meeting on Zoom.
So with COVID, Opal Network hasn't met recently, but Mind Freedom Oregon is meeting on Zoom
Every month.
every month.
And actually, I find Zoom is helping our activism.
And actually, I find that Zoom is helping our activism.
And remember, if someone doesn't have a computer, they can phone in to a meeting.
And remember that if someone does not have a computer, they can phone into the meeting.
So after this, why don't we take a little bit of a break before I finish the rest of the workshop?
So after this, why don't we take a little break before I finish the rest of the workshop?
Does that sound good?
Does that sound good?
So we'll take a little break until like for 5 minutes. Okay.
So we'll just take a little break for 5 minutes, all right?
Before we take a break, we do have a question that I thought you could just answer quickly. This is from Mandy, who's asking, can anyone join the meetings?
Yes.
Yeah.
Our Mind Freedom Oregon meeting.
You mean our Mind Freedom Oregon meetings?
I believe that's what she's referring to.
Yes, but
Yes.
they need to support our goals and principles.
Yes, but they need to support our goals and principles.
For instance,
we
found out that a white supremacist tried to join our group.
For instance, we found out a white supremacist tried to join our group.
No way.
No way.
So as long as people support our cause, we've had folks in other parts of the country join.
So as long as people support our cause, we've had folks in other parts of the country join.
I would say we better say majority survivor.
I would say we better say majority survivors.
But that has not been an issue yet.
But that's not been an issue yet.
Anything else?
Anything else?
I think that was it. That was the only question.
Okay.
Hey, David, I got a quick question. So she sent a chat that said, how does she find out how to attend the meeting?
Email to me.
Email to me?
Okay, email.
Yeah. Why? Yeah. Slide and chat has my email address.
Yeah, we'll have a slide with my email address and it's in the chat.
And by the way, we've started the Portland Mind Freedom.
And by the way, we've started the Portland Mind Freedom.
Okay, break time.
Okay, break time. Unmute again.
I think we need to mute someone.
Oh yeah. Okay, I'm on it. Okay, we're good.
Hi, everybody.
Hi, everybody.
Okay, I hope we had a great break.
I hope you had a great break.
Because we are about combining support and activism.
Because we're about combining support and activism.
So, next slide.
So next slide.
So I went to Africa to find out why was our biggest group in the poorest country.
So I went to Africa to find out why our biggest group was in the poorest country.
Their office was bigger than our main office.
Their office was bigger than our main office.
So I
Wow.
spent 10 days there.
So I spent 10 days there.
And really, there are some wonderful activists there,
And really, there are some wonderful activists there.
such as Attorney Janet, who's a psych survivor.
Such as Attorney Janet, who's a psych survivor.
But I got to know Dan Taylor,
And I got to know Dan Taylor.
and I really think that Dan brings this kind of savvy
And I really think that Dan brings this kind of savvy,
determination.
determination.
He used to be a salesperson before he was an activist.
He used to be a salesperson before he was an activist.
And anyway, I was very impressed.
And anyway, I was very impressed.
They apply for grants well
They apply for grants well
and complete the actions.
and complete the actions.
You'll see our reference there to CRPD
You'll see our reference there to CRPD.
all over the world for years. They've been talking about this.
All over the world for years, they've been talking about this.
And that's a convention on the rights for people with disabilities.
And that's the Convention for the Rights of People with Disabilities.
And that was adopted in the UN. Mind Freedom had a rep there.
And that was adopted in the UN, and Mind Freedom had a rep there.
There were dozens of psych survivors there.
And there were dozens of psych survivors there.
And also you see World Health Organization.
And also you'll see World Health Organization.
If you Google quality rights,
If you Google quality rights,
one word,
World
Health Organization,
Organization,
you'll see that even there we have had a big effect.
you'll see that even there, we've had a big effect.
Okay.
Okay, next slide.
You know, in a way, I can sound very optimistic as I give this workshop.
Now, in a way, I can sound very optimistic as I give this workshop,
But I was director of Mind Freedom for 25 years.
but I was director of Mind Freedom for 25 years,
And I expected that there would be hundreds of affiliates after that.
and I expected there would be hundreds of affiliates after that,
But no,
but no,
it's difficult.
it's difficult.
Now, Florida has an affiliate.
Now, Florida has an affiliate.
Frank Blankenship helps keep it together there.
Frank Blankenship helps keep it together there.
And notice that Ireland, Mary, and Ghana, Dan, and Florida, Frank.
Notice that in Ireland with Mary, Ghana with Dan, Florida with Frank.
Maybe you.
Maybe you.
In your area.
In your area.
One person can do a lot.
One person can do a lot.
So if you want to become an affiliate.
So if you want to become an affiliate.
Or start an affiliate. We are working on revising the whole system.
We are working on revising the whole system.
I'm a consultant to Mind Freedom on this.
I'm a consultant to Mind Freedom on this.
And we're doing a lot.
We
have a volunteer, John Marshall.
We have a volunteer, John Marshall.
And we are creating a toolkit.
And we're creating a toolkit.
And it's really easy to create a public Facebook.
And it's very easy to create a public Facebook.
But we are also working on a private thing that's like Facebook.
But we are also working on a private kind of thing that's like Facebook.
So you can network with your group privately.
So that you could network with your group privately.
And starting a local affiliate does not take a lot of work.
And starting a local affiliate does not take a lot of work.
You can connect with some amazing folks.
You can connect with some amazing folks.
So an affiliate simply uses the word Mind Freedom.
So an affiliate simply uses the word Mind Freedom.
Like Chrissy runs Mind Freedom Lane County.
Like how Chrissy runs Mind Freedom Lane County.
And Frank, Mind Freedom Florida.
And Frank with Mind Freedom Florida.
So they use the name. Next slide.
Next slide.
In one campaign that's important and easy to do is to support the Mind Freedom Shield.
And one campaign that's easy and important to do is to support the Mind Freedom Shield.
It's simply one for all for one.
It's simply one for all and all for one.
If any of us on this workshop are hurt, how many people can we reach to speak out?
If any of us on this workshop are hurt, how many people can we reach to speak out?
Let me refer to Ray, photographed here.
Let me refer to Ray, photographed here.
He had forced outpatient electroshock.
He had forced outpatient electroshock.
That's right. Court ordered every week a van would come to his group home.
He was court ordered, and every week a van would come to his group home.
Bring him to a hospital for shock against his wishes.
And bring him to a hospital for shock against his wishes.
We did an international campaign.
We did an international campaign.
A bunch of us even flew in to Minneapolis to help out.
A bunch of us even flew into Minneapolis to help out.
It took longer than I thought.
It took longer than I thought.
But we won.
But we won.
Big time.
Big time.
So the idea of the shield is like Amnesty International.
So the idea of the shield is like Amnesty International.
To get dozens or hundreds of people.
To get dozens or hundreds of people.
To complain to a decision maker.
To complain to a decision maker.
So the shield is being retooled by the director, Ron Bassman.
So the shield is being retooled by the director, Ron Bassman.
Who took my place.
Who took my place.
In Mind Freedom.
At Mind Freedom.
So anybody can sign up for the shield anybody.
So anybody can sign up for the shield, anybody.
But this is a great campaign for a local affiliate
So this is a great campaign for a local affiliate
to support the shield campaign.
to support the shield campaign.
Next.
Next slide.
So I wanted to end by mentioning Oregon as land of Kenkisi.
So I wanted to end by mentioning that Oregon is the land of Ken Kesey.
I knew Ken.
I knew Ken.
He lived right near Eugene,
He lived right near Eugene,
and he wrote One Flew Over the Cuckoo's Nest.
and he wrote One Flew Over the Cuckoo's Nest.
To research it, he believed that trying everything once.
To research it, he believed in trying everything once.
And he told me he had a friend splice an extension cord.
And he told me he had a friend splice an extension cord.
Ken lay on the ground
Ken laid on the ground
and Zap had shock on his temples.
and had shocked on his temples.
He said every cell in his body cried out, "This is wrong,"
He said that every cell in his body cried out, "This is wrong,"
and changed his philosophy everything once.
and changed his philosophy about everything once.
But I bring this up because there's something special about Oregon to support free minds.
But I bring this up because there's something special about Oregon to support free minds.
And next slide.
Next slide.
Often we have events at our Kenkisi Plaza.
Often we have events in our Ken Kesey Plaza.
You can see a statue of Ken there.
You can see a statue of Ken right there.
And on your left, in purple, David Rogers.
And on your left in purple is David Rogers.
Next to him, Chuck Harvard, retired mental health worker.
Next to him is Chuck Arford, retired mental health worker.
Next to me, documentary filmmaker activist David Zupin.
And next to me is documentary filmmaker activist David Zupin.
So next slide.
Next slide.
Now, if you have a group that has your own name, like this great group, Disability Rights International.
Now, if you already have a group that has its own name, like this great group, Disability Rights International,
you can become a Mind Freedom sponsor.
you could become a Mind Freedom sponsor.
It's like an endorsement,
It's like an endorsement,
and you just have a liaison with Mind Freedom.
and you just have a liaison with Mind Freedom.
We call this our support coalition.
We call this our support coalition.
You see, folks, the movement did not come out of a government grant.
You see, folks, the movement did not come out of a government grant.
It came from supporting each other.
It came from supporting each other,
And it came from movements supporting each other.
and it came from movements supporting each other.
So whether or not you become part of a Mind Freedom, you know, let's support each other.
So whether or not you become part of Mind Freedom, let's support each other.
And we can have different opinions and approaches.
And we could have different opinions and approaches,
But we can discuss our differences in a civil way.
but we can discuss our differences in a civil way.
In the union movement, they call us solidarity.
In the union movement, they call this solidarity.
And now when I say go on LinkedIn,
So now, say when I go on LinkedIn,
there are hundreds of people involved in mental health, peer support.
There are hundreds and hundreds of people involved in mental health peer
Next
support.
slide.
Next slide.
So tomorrow I give a keynote about how we are the 100%,
And tomorrow I give a keynote about how we are the 100%,
not the 10%,
not the 10%,
not the 15%,
not the 15%,
not the 20%.
not the 20%.
We are the 100%.
We are the 100%.
So I'm proud of being a psychiatric survivor.
Sure, I'm proud of being a psychiatric
With
survivor
mad pride,
with mad pride,
lived experience.
lived experience.
But the world needs peer support as never before.
But the world needs peer support as never before.
Everybody.
Everybody.
Next slide.
Next slide.
So this is how to be in touch with Chrissy and me.
So this is how to be in touch with Chrissy and me.
And I encourage anybody to contact me.
And I encourage anybody to contact me.
In fact, affiliates are geography, mind freedom.
In fact, affiliates are geography, mind freedom.
Sponsors are groups that endorse.
And sponsors are groups that endorse.
But I am working with Mind Freedom to create a third type of group.
But I'm working with Mind Freedom to create a third type of group.
Based on interest.
Based on interest.
It doesn't matter where you live.
And it doesn't matter where you live.
Like shock survivors.
Like shock survivors.
You know, like organizing based on interest.
Like organizing based on interest.
So I really encourage you to be in touch with us.
So I really encourage you to be in touch with us.
But whether you can start an affiliate.
But whether you can start an affiliate.
Or if you're in a current group, you can be a sponsor.
Or if you're in a current group, you could be a sponsor.
Now, one cool thing about Mind Freedom.
One cool thing about Mind Freedom.
Not to criticize anyone else.
Not to criticize anyone else.
It's one of the few groups not funded by the government or corporations.
It's one of the few groups not funded by the government or corporations.
We are for revolution.
We are for revolution.
So be in touch.
So be in touch.
So why do we have time for Q&A?
So why don't we have time for Q&A?
Thank you so much for your presentations. I wanted to just go ahead and share, we did have a question in the chat asking if Chrissy could give an example of radical boundaries. Sorry.
Yeah, so radical just means foundational. So when I think of radical boundaries, I like to think of like before I start a relationship with an organization or a group of people, what are the behaviors I do that I'm not willing to take from others. I think about my past, like my failures. And I also think about like what other boundaries other people have used. I actually talk about radical boundaries in my keynote. So I really encourage you all to attend my keynote on Thursday. And I make it a little bit more clear there. I really try to give like multiple examples of what radical boundaries are. But honestly, through my research, the term radical just means foundational, like the structure of me as an activist. I have that established already.
I will add that the origin of the word radical.
I will add that the origin of the word radical
simply means to the root.
Simply means to the root.
And I'm proud to be radical.
And I'm proud to be radical.
Hey, hope I'm using the right.
So yeah, everybody feel free to ask questions. I feel like during my presentation, I talked about a lot of different skills or things that are good to have established for your organization or nonprofit to be successful with the actions that David talked about he's seen for the different Mind Freedom affiliates.
I'm just asking about getting some education for staff. I work at the state hospital. And
Hey, I think I can hear someone talking. Could you get closer to the mic or turn up your volume?
Here?
Can you hear me now?
Better.
Better.
Yeah.
Can you hear me still?
Yes.
Okay, I work at this is Delilah, I work at the state hospital in Junction City, and there was a lot of massive ignorance and all of the clinical vision of having, sorry, you'll have to forgive me, I have short-term memory issues, so let me just take a second. I'd like to get some information out to a lot of the people that I work with, the clinicians that I work alongside, or however you want to put it. And so I'm wanting to bring in something that can help folks feel the normalization of what it is to hear voices and have mental health experiences with folks that have truly been there and that are involved in things in the way that you are. I don't know if I'm on the right track, but that's what I have to say. You can get some meaning out of that in the question.
Yeah, I'll say that for those not in Oregon.
Yes, and I'll say that for those not in Oregon.
She's talking about a facility in nearby Junction City.
She's talking about a facility nearby Junction City?
That's really new.
That's fairly new.
The system claimed that it would be more progressive, like a campus.
And the system claimed it would be more progressive, like a campus.
But we still need revolution there.
But we still need revolution there.
I would encourage you to look at the potential to having a group right on the ward.
So I would encourage you to look at the potential for having a group right on the ward.
Wow.
We did that years ago. In fact, some of the early activism people right on wards united.
So we would encourage that in some of our earliest activism, people would write on wards united.
In fact, with Zoom, we might be able to even meet with them more easily.
In fact, with Zoom, we might even be able to meet with them more easily.
If the facility allows that.
If the facility allows that.
But in any case, it'd be wonderful to have a group at JC.
But in any case, it would be wonderful to have a group in JC.
I was so sad to see that place start.
I was so sad to see that place start.
Same. I don't know if you can hear me.
And then I can just add, Delilah, I think that you could send an email to the Eugene Mind Freedom office, and they could give you some trifolds about Mind Freedom, as well as one of them I'm thinking of that I really like is like, does your mental health institution need a truth injection? Do you remember that trifold, David? It's something like that, and I really like that one.
I wrote it.
I wrote it.
Yeah.
Well, trifolds like that, I think, could be really powerful to have there available for individuals.
So, were you saying something else, Delilah? I think I heard you talking. Sorry, Ian here. No? Okay.
Other questions?
Any other questions?
Or comments?
Or comments.
I see a bunch of activists out there like Ruthie Poole is an activist. Judine.
I see a bunch of
Welcome,
activists out
friends.
there like Ruthie Poole and Judine, a bunch of
Yeah.
friends.
In Massachusetts, we're organizing around the high rates of COVID in the psych hospitals. Here, are people doing that in other states? There's very high rates. They're not being transparent about it. There's all kinds of folks who are ready for discharge, and they're just sitting there, and the rates of infection are really high. Are other people organizing around that in their states?
I will say that here in Eugene, we have a group called CareWorks.
I will say that here in Eugene, we have a group called CareWorks.
And we're working with care workers and their families.
And we're working with care workers and their
And
families.
it's a small thing, but this week we have a column in the local paper about this topic.
And it's a small thing, but this week we have a column in the local paper about this topic.
Email me, I'd be glad to send it to you.
Email me and I'd be glad to send it to you.
But yes, it's a horrible, horrible tragedy.
But yes, it's a horrible, horrible tragedy.
Congregated living,
Congregated living,
and COVID.
and COVID.
Any other activists on this topic?
Any other activists on this topic?
Yes, this is Deb Jorgensen from Arizona, and I work with a group, the Arizona Peer and Family Coalition, and we have been calling out the lack of testing and the lack of resources in our in our own population, and also with minorities, because it's just, they're getting tests back 2 weeks later. That doesn't do any good. And I can go and I can get my test tomorrow, and the results. So, and just the lack of testing, the lack of information that's getting out to the, those communities of color. So it's been kind of interesting. We're working with both the governor's office and our Medicaid access thing. So that's one piece. And there's another issue that's been really boiling here in Arizona, not because it's as hot as it is, but because it is so wrong. And that is, it's called, they passed a bill that can keep you up to 2 years in locked residential facilities. You're not arrested. You just have to be deemed not able to take care of yourself and a danger to yourself or others. And so it kind of circumvents our COT process, which is already bad enough, the forced treatment that's there. And it's kind of stalled because there's not, the interest group that brought that all to bear is a few moneyed parents who kind of took over our MHA chapter here in Arizona, and but they're backed by national support, and they've got a senator, a representative, House representative that is really active in making all of this happen. And it's without any kind of input from our community at all. And it's been
Deb, here in Oregon.
Deb, here in Oregon,
there's everyone in Oregon should know this.
and everyone in Oregon should know this.
State Senator Floyd Brzezinski
State Senator Floyd Przansky
has for a couple of years
has for a couple of years
had a special committee
had a special committee
he does now
called
the decriminalization of mental illness.
Decriminalization of Mental Illness.
And I've gotten on there
And I've gotten on there
and had them start a special committee
and had them start a special committee
for inclusion of our voice.
so for inclusion of our voice.
Nothing about us without us.
Nothing about us without us.
That's been a theme of the whole disability movement.
And that's been a theme of the whole disability movement.
So getting inclusion in the voice can be a great issue.
So getting that inclusion and a voice can be a great issue.
Shira, I would like to ask about the time check. Should we do breakout groups now?
Yeah, so I'll go ahead and set those up.
So what?
Okay.
Look like when they're successful. So now one of the things that we would like you guys all to talk about is what do you want to do and what do you want to bring back to your organization? And then along with that talk, let's be honest about the barriers, the obstacles, and maybe talk about some tangible goals. So would anybody like to talk about what they sort of hope to bring back to their organization on the concept of winning human rights and mental health with campaign action team and support?
Well,
Go ahead.
I was just thinking that, so I work for Deschutes County, and I feel like that's kind of a gift working within the county to create an sort of activate ideas within that realm of the county. And so I have a lot to think about, and I'm pretty new to the job, so I'd like to hear ideas, of anyone that's worked within the county, how they've done activism. So.
I definitely understand about the benefits of working in the belly of the beast can offer us. Would anybody like to talk to that? Any experience of how to be successful? So Jennifer, what I hear you saying is that you work for Deschutes County and you really feel like that you're wanting to put some energy for consumers at the county level. Has anyone ever done anything like that before?
I have not.
I'm at the county level with mental health. I work in a respite center and I'm a consumer and worked doing housing for 4 years and then transferred after we had several different managers change, and last was support, and my supervisor had cancer. She was a very experienced woman out of St. Helens. Anyways, the county, the public mental health systems are connected to the state, the local, the federal, and it's a big complex system. We have some consumers working there, and it's pretty difficult to be on the mark, so to say, of human rights or what you're thinking could be detrimental to somebody on every occasion. And if you have constant disagreements and conflict with things that are happening, there's no way to have a relationship with the mental health agency. So there has to be some streamlining of convictions. There's one thing being on the outside and coming in and activating from an outside organization not being employed, but being employed you're automatically compromised to some degree if you want to be on the mark. And so I see what you guys are doing. You're not connected to corporations, I heard David say, or the government. And you're using the word radical, which is a little spooky, but you're defining it as foundational and roots of something. And so I'm always finding that there's compromise, and it gets sickening when people are over medicated, even in a respite center. It gets sickening that there's nobody there that isn't medicated. I guess that's personal information I'm breaching. But success, I think, might involve being separate from the organization if you want to have an impact. And I wouldn't not advise communicating to directors of mental health agencies. I would advise it. And I would advise talking to managers and assistant managers and their unions about what some of the convictions are of an organization such as Mind Freedom. And I don't think it would take an hour or two. I think it can be done. I think you guys did several presentations today, all of which were like 20 to 25 minutes at different segments. I think you could get it done by summarizing it probably in 15, 20 minutes. And
Yeah.
I think you could have impact getting a hold of the leadership or the board of directors of community mental health programs. And I think that they'd be refreshed to hear it. I think they'd like to hear from you. And I don't think it has to be a conflicted conversation. I think it can be educational. So that's my thoughts from the county.
I like
Thank
that.
you so much, Steve, on that. Go ahead, Jennifer.
Oh no, I was just saying I like that. Just, you know, very basic, like educating. That's what I took away from that. That's good.
Yeah. So what I heard Steve say that I really liked was being separate from the county and then also getting in touch with the boards. I think that could be a really smart idea. Like at Lane County Behavioral Health, they have an advisory committee, and then they also have like a higher up for employees and stuff, like an advisory council. So both of those can be really good to touch bases with, to sort of just build up some momentum. And then also, what I really hear you saying, Jennifer, is that you're almost going to be like the liaison between your position and then what you want to create with the consumers. So just really allowing yourself to take that authentic voice of what you're hearing from your consumers and then bringing it to your management or leadership, and then being that middle person. I find a lot of strength in sharing other people's ideas. You know, like I feel a lot stronger advocating for someone else than myself. Classic peer tactics. So I would really hold strong to your liaison and utilize the power of speaking up for your consumers as a catalyst for crushing any no's that you could get from leadership.
I wanted to give a plug for the CMHP, the respite center I'm working for, and that is that there is no restraint, there is no forced medication. Those are two big pluses for me. And I've had an impact. I wonder if it's my own laziness or apathy, but I've had my own influence of giving the clients lots of space and not trying to control them or change their mind or change their future, but to let them. And I'm nice as I can be, but if they want to talk, they'll talk. If they don't want to talk, I'm not going to give them. This might be laziness, I'm not sure, but I don't just feel like I have to change them. And if they need time at a respite center to rest, I'm giving them lots of space to do that. And,
Thank you so much, Steve. Would anybody, we have a couple more minutes, would anybody else like to talk of something that they want to bring back to their organization? Or,
process, and to remember to just be, I don't know, work with my team as best as I can, and to remember to be like an advocate for just who I'm working with and to keep everything in mind. But yeah, it gave me a lot of insight, this did.
great, I'm glad to hear that. Well, we just all received a message. We have about a minute or so left of this group. I guess I'm just going to ask a really bold question. Does anybody feel like that there's really barriers or limitations that they feel really close with about the idea of wanting to try and launch an affiliate with Mind Freedom or speaking up for consumers' rights or anything like that in the groups that you're currently with?
I don't think that there's any barriers for a couple of the programs that I'm personally affiliated with. I think that just they need to know that they have permission, you know, and then also for me, when the mental health movement started, I was so it was so refreshing. And I actually educated myself a lot about having the diagnoses, but not matching them. And then the understanding that I didn't have to be told who I was. So for me, it was like a mini revelation, right? This was years ago. But I think that when people aren't given the option that they can seek other information and can learn different, that they don't know to, you know? So for me, I think awareness, having a voice to give others a voice.
Thank you so much, Mandy Jo. That's completely true. In fact, one of Mind Freedom's stances, so many people feel like we're anti-medication, but really Mind Freedom holds the stance of they want individuals to be informed of the alternatives as well as multiple options. Like just being informed with the knowledge, it really helps build active consent into whatever therapy that people do choose to take. So I really feel like that's what Mandy Jo just said, is just really arming the consumers that we get to work with understanding about those options and giving them a handful of choices instead of one.
You said it so much better.
Thanks. So I think that we're probably going to be ending soon. So I just want to thank you all for participating in today's workshop. And I hope that you all have a joyous rest of this virtual peerpocalypse. And again, I have a keynote on Thursday that I am so looking forward to giving. So I hope you all attend to see me break through my limitations and be successful with that. Maybe cherry face, tomato face will come out, who knows? I'll get through it though.
So far,
but just want to, thank you. Just want to say thank you again to you all and have a great rest of your day.
Thank you.
Thank you.